Hello people, in today's video we will be learning about meningitis. So first of all, you have to keep in mind that everything which has the suffix itis, it refers to the inflammatory involvement of something, okay? However, there are exceptions everywhere. Now, what meningitis is, it's the inflammatory involvement of what? Of meninges. Now, what meninges are? These are the membranous coverings of brain and spinal cord. As you already know, as you have learned these all terminologies like meninges, dura, pia, arachnoid. So here I don't have to explain them, okay? So it may, if it involves the dura matter, it may be that time called pack meningitis, and if pia and arachnoid matter, then it's called leptomeningitis, as this pia and arachnoid. These are also known as leptomeninges, okay? As leptomeninges consist of an arachnoid matter, and it forms the delicate vascular membrane covering of what? Of central nervous system, okay? And you know that pia matter is closely applied to brain, and where arachnoid matter, it lies between the pia and the dura matter, and the dura matter is the tough fibrous covering of the brain which is closely attached to skull, okay? You all know these all terms. So here we will see this pack meningitis, okay? It is what? It is what's the cause? Okay, we can see that it may be an extension of what? Extension of inflammation from what? From chronic suppurative otis media. You know what otis media is? It's inflammation of the middle ear. And secondly, it may occur due to the fracture of skull, okay? Now, what will happen in the pack meningitis? An extradural abscess, okay? Extradural abscess. It may form, okay? It may form between what? Between the bone and the dura, okay? What bone? Periosteum and the dura matter. An extradural abscess may be formed, okay? Now what will happen? The further spread of infection, it will do what? It will penetrate what? It will penetrate the dura, okay? And it will form subdural abscess. Okay? And there may be some other effects of what? Of pack meningitis, and that those effects will be either localized or we can say generalized what? Generalized leptomeningitis, okay? And cerebral abscess. And secondly, we saw that the meningitis, it may involve the leptomeninges, and it may be that time called leptomeningitis, okay? It's the common, or we can say it's commonly called as what? Called as meningitis, okay? And you know, this infectious, if we will see what infectious, and one most important point, that is commonly caused by what? It's commonly caused by infection, okay? And the infectious meningitis, okay? Infectious meningitis is broadly classified into three types. First is the acute pyogenic, okay? Acute pyogenic. Second is the acute lymphocytic, or it's also known as viral, or we can say aseptic. And third type is chronic. It may be bacterial or fungal, okay? So these are the three classifications of infectious meningitis, or we can say leptomeningitis or meningitis, okay? So the first classification is acute pyogenic meningitis, or it's also called as acute purulent. Now why the term purulent? Because it contains what? It contains pus, okay? Now what it is? It's an acute infection, okay? It's an acute infection of what? Acute infection of pia and arachnoid matter, and the CSF, okay, which is enclosed in what? CF is enclosed in what? Subarachnoid space. So here it may involve the pia matter, the arachnoid matter, and the subarachnoid space, which will the subarachnoid space is already having the CSF. So here in the acute pyogenic meningitis, it will directly affect what? The CSF. Okay. So as you know, the subarachnoid space, it is around the spinal cord, the brain, and the optic nerve. So what will happen? The infection means spread. It means spread to the whole of the what? Whole of the cerebrospinal meninges, and sometimes to the ventricles. Okay, ventricles as well. Now in the acute pyogenic meningitis, we will be dealing with the etiopathogenesis, with the morphological features, with the clinical features, and with the diagnosis. Okay, so let's talk about these things one by one. The first thing we have to deal with is the etiopathogenesis. Okay, the important thing you have to keep in mind is that the causative organism. Okay, the causative organism of meningitis, it vary with what? It vary with age. Here we classified the age into 4 groups. First, neonates, infants and children, adolescents and young adults, and the extremes of age. In the neonates, the causative agent is the E. coli, causative organism, and in infants it's the Haemophilus influenzae, and in adolescents and young adults it's the Neisseria meningitidis, and it's also known as meningococcus, and in the extremes of age it's the Streptococcus pneumoniae, and it's also called as pneumococcus. So we will see now what are the routes of infection. So first is the bloodstream, which is the most common route we can say, and second is the adjacent forks of infection, or we can say next to infection, and third is the iatrogenic infection. That's introduction of microorganisms at the time of operation, or we can say at the time of lumbar puncture, also called as spinal tap. Okay, now the second thing we are about to deal with are the morphologic features, and we can see grossly the pus will accumulate. It will accumulate in the subarachnoid space, so that the CSF, which is usually normal, we can say which is clear, it becomes purulent, or we can say cloudy, purulent, or frankly purulent, we can say, and turbid. Now what will happen? It will, the turbid fluid, it's particularly seen in the base of the brain and sulci, usually where the space is wide. Okay, now what will happen? The turbid CSF, or we can say the purulent material, it will interfere with the flow of the CSF, and it will result in the obstructive hydrocephalus. Now what will happen in the obstructive hydrocephalus? It will build a fluid. Now when the fluid is built in the deep cavities, that's termed as obstructive hydrocephalus. Okay, now what will happen microscopically? As we saw grossly, now what will happen microscopically? There will be the presence of numerous PMNs, polymorphonuclear neutrophils, in subarachnoid space and around the blood vessels. So it was about the morphological features. Now let's have a look towards the clinical features. So acute pyogenic meningitis, it is a medical emergency. Okay, and the immediate clinical manifestations will be the fever and severe headache, vomiting, drowsiness, stupor. Now what stupor is? It's the lack of mental function. Okay, the mental function of the person is completely, or we can say partially, lost. And what will happen to that person? In spite of being in a level of consciousness, that person will not respond to a stimulus, normal stimulus. And what coma is? Coma is usually, we can say, it's a period of prolonged unconsciousness. Okay, prolonged unconsciousness, we can say it's a period of prolonged unconsciousness. Now what's the convulsion? Convulsion happen occasionally. Now what happen in the convulsion? The body muscles contract and relax rapidly and repeatedly, and it results in the uncontrolled shaking. The important clinical sign in the acute pyogenic meningitis is the stiffness of neck. Now what's the stiffness? Is the limited flexibility of neck on forward bending. So it's the important clinical feature. Now let's have a look towards the diagnosis. So the diagnosis, okay, it's confirmed by examining CSF as soon as possible, and the diagnostic alteration in the CSF in acute pyogenic meningitis are as under. So first is naked appearance of cloudy purulent CSF. Second, the CSF pressure is elevated above 180 mm water. Now what it is usually, it's usually below, it's usually we can say 100 to 180. Now the third is PMN, polymorphoneutrophilic leukocytosis, between 10 to 10,000 per ml. Okay. And the fourth diagnostic alternation we can see in CSF is the protein level of CSF that's raised, that's above 50 mg per deciliter. Fifth is the sugar concentration that's decreased, that's we can say that decreases and is lower than 40 mg per deciliter. And sixth, the bacteriologic examination, which we did by gram staining, or which is done by gram staining, that reveals what? That reveals the causative organism. Okay, this was all about the acute pyogenic meningitis. Hope you would have liked my video. Thank you so much for watching.